As millions of Americans continue to stay at home, this new era of social distancing may leave many feeling very much alone. But according to a former U.S. Surgeon General, Americans were feeling lonely long before the crisis cut us off from most social contact. Dr. Vivek Murthy, who served in the Obama administration, has traveled across the country to hear firsthand about Americans' health concerns, expecting to discuss the opioid epidemic and heart disease. He discovered instead the startling number of Americans suffering from loneliness. He tackles this timely subject in his new book, Together, The Healing Power of Human Connection in a Sometimes Lonely World. Author and the 19th U.S. Surgeon General, Dr. Vivek Murthy, joins me now. Dr. Murthy, first, I want to capitalize on your expertise as a public health expert. It was just announced this morning that you're part of Joe Biden and Senator Bernie Sanders' Unity Task Force. What will your advice be to prevent a second surge of coronavirus cases in the U.S.?
Well, what we know, Rena, is that, number one, that we have the science and the capability to address this pandemic, but we have to make sure that we're moving forward efficiently on a few key fronts. So number one, if we want to prevent more damage in the fall, we have to expand our testing dramatically. That means not just the number of tests, but making sure that the distribution of tests is wide and that the turnaround for test results is also short. We also have to build up our contact tracing ability. Right now, we have just a small fraction of the number of people who can do contact tracing in the country that we will require to put a net over infections and contain them once we find them. And finally, we have to put these in place and keep social distancing in place as well until we see cases come down in a sustained way. We know that there are states in the United States which are already relaxing social distancing rules, but they're doing so while they're still seeing either an upward trend in cases or a stagnation in new cases. And that, unfortunately, is a recipe for further spread.
Dr. Murthy, I got to tell you, the social distancing, we keep hearing just how important it is. But I got to tell you, even personally, it is so hard when you think about the summer starting and you want to get together with your friends and you start thinking, maybe we can socially distance, you stay 6 feet apart. The reality is it's nearly impossible to do. In your book, you write about the power of human connection. What do you believe this pandemic is costing us in terms of social contact?
Well, I'm glad you asked, Rena. I do think that this is one of the costs that we have not fully appreciated of this pandemic. We've talked about the direct health impact. We've talked about the economic costs, and both of these are extraordinarily important. But there is a social cost as well. The more we are physically distant from each other, the more we run the risk of deepening our loneliness, a loneliness that existed quite broadly in the population of the United States and in many countries around the world. And what we know now, Rena, is that loneliness is associated with an increased risk of health problems, an increased risk of heart disease and dementia in particular, of depression and anxiety, even the increased risk of premature death. So what we have to recognize is that we have to be intentional about how we approach our relationships in this moment. We have to see them not just as nice to have, but as necessary, as one of the most important tools we have for improving our health. And that means even though we can't see each other, leaning into technology to ensure that we're spending at least 15 minutes a day with each other, that we're making the time count by reducing distraction and improving the quality of our interactions. And finally, we have to seek each other out with opportunities and with a willingness to serve, recognizing that when we help others, that is actually one of the most powerful ways that we can build connection and address loneliness. And there are plenty of people hurting now, plenty of opportunities for us to step up and serve.
The United Kingdom caught on to this problem of loneliness, and they created what's called a ministry of loneliness. I know a lot of people laughed at it, thought it was kind of comical that they would even start this. But how do you seriously approach the U.S. government about addressing this issue of loneliness?
Well, Rena, when you understand the data behind loneliness, when you see how it dramatically impacts our health, our performance in the workplace, and our kids' performance in school, it becomes very clear that the social connection in a population is actually a strategic priority and a strategic resource. And we have to approach it that way as individuals, as workplaces and schools, and also as a government. So that means that when we're shaping policy, that we need to not only think about the financial impact of that policy, but also about the impact on community and human relationships. And it means as a country, we need to be prioritizing human connection, meaning that we invest in research, that we establish metrics, that we understand what works and doesn't, when it comes to building community. And that's a place where government can play a unique role. So this is of strategic value, it's of personal value. If we want to build healthier, more resilient, more fulfilling lives, that starts with building stronger connection.
Whether you're living alone during this pandemic or even with a family, you can still feel very lonely. What's your advice for people suffering from loneliness in the midst of this pandemic?
Well, as somebody who has struggled with loneliness at many points in my own life, when I was a child and at many points when I was an adult as well, including when I served as Surgeon General, I want people to know that if you are struggling with loneliness, please know that you are not alone, that many others are having that similar experience. But I also want you to know that because you are lonely does not mean that you are broken. It does not mean that you are unlikable or deficient in some way. Loneliness is a natural signal that our body sends all of us at one point or another in our lives that tells us that we need to reach out to others, that we need to build stronger relationships. So just know that loneliness it's a human condition. It's a common condition, but it's one that we can address. We can do that by building stronger relationships, by serving others, by showing up, even if we have a few minutes, to spending quality time with the people that we love. And if we do these small steps, I have found they can make a big difference in helping us lead more connected and fulfilling lives.
I think it's just powerful talking about it because so many people don't think it's a condition or an issue that really should be addressed. And hearing you talk about this is so powerful. The book is called Together, The Healing Power of Human Connection in a Sometimes Lonely World. Dr. Vivek Murthy, thank you very much for joining us.
Thank you so much, Rena. Take care.